Good evening, everyone. How you guys doing? You all are welcome to my channel this evening, and I'm one and only Queen Health Nurse. She's here again to lecture us. So, without no wasting you guys' time, I'm here with this topic that says top 5 rules of a theater nurse. Top 5 rules of a theater nurse. If you understand, our theater nurse normally have rules and regulations, right? And as the one of them, we have rules and regulation in theater. Not only in theater, in other words. So we are here with the top 5 rules of theater nurse. Top 5 rules of theater nurse. So we're here just to tell you guys how the theater rules works. A theater nurse is also called an operating room nurse. Operating room nurse. What do I mean by operating room nurse? Operation, like operating room nurse. So plays a very important role before and after surgery. So number one of our top 5 rules of nurses is we have preparation, like preparing the operating theater. The theater nurse ensures the operating room is clean, sterilized, and ready for surgery. Some few of the duties: arranging surgical instruments, checking equipment, preparing sterilized materials, making sure infection control standards are followed. That is as number one. You make sure your theater instruments are complete. You make sure your theater is neat to go. You make sure that the infection control is followed as well, so that a patient will not contact infection after surgery. So we have the number 2 of our top 5 rules of a theater nurse. We have assisting during surgery. A nurse supports the surgeon and surgical teams throughout operation. These are one of some few duties of a nurse in the theater room. Passing instruments to the surgeon. You guys know what a surgeon. A surgeon is a person who operates, who normally do operation. So monitoring instruments, procedures, then helping maintain patient safety. You will always maintain patient safety. Always maintain patient safety. So we have number 3. Which says monitoring the patient. A theater nurse closely watched the patient before and after surgery. A theater nurse closely watched a patient before and after surgery. Sorry, my bad. So these are the monitoring things. These are the monitor things required that you as in theater nurse supposed to be doing at any surgery that was attended or that was given to a patient. You first can check the vital signs, the pulse, the heartbeat, and the respiration, the BP, nothing much. You check the vital signs, which contains 4: the temperature, the pulse, the respiration, and the BP. That's the 4 things. Then we also have patient's condition. You go and check the patient condition, whether the condition is okay or he or she is feeling uncomfortable. So that's just it. Then we have bleeding. When surgery is done, you normally go to a theater nurse normally go to the patient and see if he or she is bleeding, is having bleeding from that surgery. Then we have a reaction to analgesics. You also monitor when some nurses gave her or some nurses gave him injection like antibiotics and all these things. You monitor whether she reacts on those drugs, whether she reacts on those drugs and all that. So signs of complication, you know what that means. Signs of complication, you always monitor if she is having signs of complication. Then we have number 4, which is preventing infection. One major rule is preventing hospital acquired infection, which is what we talked about last. That was it earlier this week that we talked about it. So we have the nursings in how to ensure that this is what it is. Like we have a proper hand hanger. You make sure you have a proper hand hanger in the hospital. You make sure it is in the hospital. Safe handling of instruments. Make sure you put on your glove before handling any instrument, and make sure your instruments are sterilized before putting your glove and touching them. So that's just it. The other one, we have a clean surgical environment. Clean surgical environment. When you clean your theater and your theater smells good and neat, it will not cause any infection. It will not cause any damage. We have number 5, which is the last but not the least. We have preventing patients' care and supports the theater nurse resorption. Like preventing patients' care and supports the theater nurse, reassuring and supports patients emotionally. When you support patients emotionally, it will get well faster than any other thing. Then these are the things that you do to make sure the patient is okay and that the patient is in safe hand. Explain the procedure first before he or she is going into the theater. You explain why they are going to do the operation. You explain how the operation works. You explain to her how long it's going to take her in that theater. That is what we mean by explaining the procedure to a patient, so that patient will not be scared. So calming a patient down is also one of it. When a patient is scared of going into theater or is afraid of how am I going to go into theater like this? What will my children do if I died? Like if I die on the process of on the process of surgery going on, what will my children say? What will my husband do? So that will give you the encourage of telling that person, encouraging her or encouraging him to stay calm. Nothing will happen to him or her. He or she will come out safely, will go in and come out safely. That is why calming the patients down is okay when they are scared of going into theater. So that's just it. We also have help patients recover after surgery. When you normally crack joke with patients, give them their duty treatment, their normal treatment, always be there for them, you see they will recover quick in surgery more than any other thing. So we also have provide post-operative care. You know what that means? Post-operative care. Always give your patients or provide them a post-operative care. Always give them that care they need, that attention they want. Always give them that post-operative care. Instruments, situation, post-operative situation. So thank you guys for being here with us, and thank you for listening to my channel. Thank you for my video. Thank you for staying here with me for my video. I really appreciate it. If you also want to subscribe, please do well to subscribe. I'll be so much happy and I'll be so much glad to see you subscribe for another channel, for another video. Thank you so much. We call it an end here. This is our last topic for today. So it will not be the least. It is the last but not the least. So the list will also come along. Thank you so much. I really appreciate, guys. Do well to have a lovely day ahead. Please do well to like and share, view my channel. I really appreciate it. If you want to subscribe, you can also subscribe, and if you want to search for me, you can search Queen Health Nurse. Thank you so much, guys. I really appreciate it. Bye. See you next on my next video.